Around 6 minutes past 10 from Women Radio 91.7, Nigeria's first and the only radio station for women and their families. Glad to know that you're still there tuned in today's dial. This is Women Radio. Yes, I'm super glad to have you on the other side listening to the sound of my voice. Today is Friday, day 22 in the month of March 2024. How are you doing today? I really do hope that your morning has been a very, very lovely one for you. As always, I would like to ask you again, how are you taking care of yourself? Are you trying as much as possible to, eat well, sleep well, exercise well, and of course, prioritize your health and well-being in general? Very, very important. My name is Blessing Agwait, and this is why I get to welcome you to Radio Doctor. Radio Doctor is a free house consultation program where medical doctors advise for free, and of course, it is Nigeria's first specialized radio health program where medical doctors consult for free and advise on Women Radio. It is broadcast Mondays through to Fridays, 10 a.m. through to 11 a.m. Once again, my name is Blessing. And wait, and our radio doctor for today is Dr. Abiola Ajayi, the MD CEO of RA Specialist Hospital. Good morning, Dr. Abiola. How are you doing today? Hi, Dr. Abiola. Hi, Dr. Abiola. Okay, I don't know. I hope you can hear me though. Hello. All right, Dr. Abiola, please, I would like you to check your device. If you can hear me, it would be really nice. Okay, I guess. All right, Dr. Abiola, can you hear me, please?
Yes, I can.
All right. Good morning. Good to have you on the show today.
Thank you very much. Good morning.
Good morning. It's so good to have you. Thank you very much for joining us on the show today as we try to have a great conversation on on the show today. Okay, so yes, like I said, our radio doctor for today is Dr. Abiola Jai, the MD CEO of our specialist hospital, and he will be consulting and advising on meningitis. The phone lines are open. You can call us in 07000 917 917. Send us a text and WhatsApp message on 0703 175 6537. Log into our website www.wfm917.com. Download the mobile app WFM 917. Send your thoughts to our social media platforms WFM 917. That is how you can be a part of the conversation for today. Like I said, we're talking about meningitis, and I really do hope that you are ready to, pick one or two things from the conversation today. Now, as always, I'll advise you to grab a pen so that you can pen down every new thing you learn. So, Dr. Abila, let's delve into the conversation already for today. As a medical doctor, I would like you to enlighten us when they say meningitis, what comes to mind? What is meningitis? And what is the difference between meningitis and other types of outbreak?
Well, let's define a few terms first. When we say meningitis, we're talking about inflammation or an infection of the meninges. And a lot of people won't know what meninges are. Meninges are, they're three meninges. They're like layers of, almost like layers of skin with like layers of tissue that help cover the brain and the spinal cord. So we have three of them: the dura mater, the arachnoid, and the pia mater. And those three very thin layers protect the brain and also protect something called the subarachnoid space, where we have a fluid called cerebral spinal fluid. Cerebral spinal fluid is just as it sounds. It covers the cerebrum, which is the brain, and it bathes the brain and the spinal cord in a sterile, meaning no bacteria, no viruses, no fungus, in a sterile solution that helps protect everything.
Hmm.
So when those layers that surround the brain and spinal cord, like we call them meningitis, meninges, when they get infected or inflamed, then we now have meningitis.
Hmm.
And as our listeners look at the topic was cerebral spinal meningitis, and that's what we're talking about. So infection of that spinal fluid, that fluid that covers the brain and the spinal cord, infection of the covering that separates, the skull from the brain and the bones of the back from the spinal cord is when we have cerebral spinal meningitis.
Mm. All right, thank you very much. So let's talk about how you haven't answered the second question, which has to do with
Yes.
differentiating between meningitis and other outbreak.
Yeah. So when you have more meningitis by than expected, we have a CDC, Centers for Disease Control, the NCDC. If you have an infection that's more in the population that's more than expected, it now becomes an epidemic, and we do have some of that in the country. Why is it different from other infections? One of the reasons is that it's extremely deadly once you contract it. For example, children can die within 24 to 48 hours after contracting this. Adults the
Hmm.
same way. So it's very different from we also have an endemic or epidemic of HIV. It's very different from that. That may take you years before you even know that you have it. Something like meningitis, you do not have a week to last with a meningitis infection, especially the bacterial kind, which I think we'll be focusing on today. So it's extremely deadly if you have it. It affects all ages, but it affects children or neonates, newborns as well. So this is why we treat it a little bit differently than we treat other infections.
Hmm. All right, thank you very much for your thoughts on the show this morning. I really do appreciate you. 07000 That is the number to call to be a part of the conversation. Send us a text and a WhatsApp message on 0703 175 6537. Log into our website www.thebfm917.com. Download the mobile app, the BFM 917, sending your thoughts to our social media platforms, the BFM 917. That is how you can be a part of the conversation for today. 40 minutes past 10 from Women Radio 91.7. If you have any question for Dr. Abiola this morning on Radio Doctor, please do not hesitate to call us on 07000 Send us a text and WhatsApp message on 0703 Log into our website www.thebfm917.com. Download the mobile app, the BFM 917. Send your thoughts to our social media platforms, the BFM 917. That is how you can be a part of the conversation for today. My name is Blessing Agleto, and our radio doctor for today is Dr. Abiola Ajayi, the MD of our specialist hospital. And today on the show, we're talking about meningitis. Now, Dr. Abiola, I would like you to enlighten us on what we need to know when it comes to meningitis. What are the common symptoms that everybody should be aware of? I mean, that when you notice this happening to you, you get to know that, okay, so you have meningitis and it is important for you to go to the hospital to seek care.
So you know, we'll talk about the different age groups later, which may have a few different symptoms, but I'll talk about the common symptoms now.
Okay.
One of the things you'll notice with meningitis is a sudden, very high fever, and sudden is an important part of it, and high is a very important part of it. We talked about, I think about 2 weeks ago, we talked about fever a little bit,
Mm,
and we said 40 degrees or 100.4 is considered severe. With meningitis, we've seen people 42 degrees, 43 degrees, which every 1 degree is a huge jump. I've never seen somebody get up to 45 degrees and be alive. So it's very, 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 very high fever. At times, if you notice, if you understand inflammation or swelling, and you know that our brain, between our brain and the skull is a very small space, and that's where this cerebral spinal fluid is, and our meninges and all the coverings. So if you have inflammation or swelling, imagine pushing something in a confined space like the skull. You're now going to have a headache, and so you'll have severe headache. Those two are very common. Some other ones you'll have, which are plus or minus, may be there or may not be there, neck stiffness. So you have a sudden fever, severe headache, plus or minus neck stiffness. Those are the top three signs, or excuse me, top three symptoms. But also associated with it is something called photophobia. when you may have a headache, but you go out in the sun and you look at the light, you can't even look at you can't even stand bright lights, whether it's outside or whether it's inside. That's called photophobia, and it's an important sign to let you know that it may be something involving the brain or the spinal cord.
Mm,
Of course, people can be nauseated and vomit. And a final sign is altered mental status, meaning person may act confused or start speaking funny or start acting funny, and can even progress into convulsions or seizures. So just to recap, we talked about fever, headache, neck stiffness, sensitivity to light, and change in your mental status. Those
mm,
are the most common
mm,
ones.
mm. All right, thank you very much for your thoughts on that one. I mean, talking about the high fever you mentioned, I know there was a particular time I was supposed to go to Sokoto for my NYC, and then we were actually advised to take the vaccine due to how hot the region is. So it was one of the things we were advised to take, especially for people like us who have never been to that part. We're advised to, ensure that we're vaccinated. We take the meningitis vaccine before coming down, especially for those who intend to settle down there, so that, our body can actually, prepare for the weather in that particular region. So I want to ask you, can vaccination prevent meningitis? And when we talk about getting the vaccine, who is supposed to get the vaccine? Can children get the vaccine? Can adults get the vaccine? Can elderly ones get the vaccine? Who is typically recommended to get the vaccine?
Okay, so that's a good question. There is a vaccine for especially meningococcal disease. So when I say meningococcal, that's one of the types of bacteria that cause it, and we'll go over those later. But we're still talking about bacterial meningitis. There are four main types of vaccine. The first three are the most common, and you talked about ages. I won't go into the different types of vaccine because it's quite complicated. But if anybody's reading on Google or following along, you'll have something called MENA, MENB, and we'll talk about those moving forward. But you have one type of vaccine that you use for adolescents up to 12 years old. And then when they use that type of vaccine, they're meant to get a booster at around 16. Because there's so many different bacteria that cause bacterial meningitis. You have different vaccines for each, and
Okay.
different ages for each. So, for example, and the vaccines are meant to target specific bacteria.
Mm,
So, for example, we have a bacteria called Streptococcus pneumonia, and this is a bacteria that in newborns and in children they can cause ear infections, pneumonia, sinus infections, but they can also cause bacterial meningitis. So these are newborns and children under the age of 5. They deserve a vaccine for pneumococcals. For teenagers are, like I said, up to 12, and then a booster at age 16. They get the meningococcal vaccine for something called Neisseria meningis. For those that get H flu, the vaccine is another bacteria called Haemophilus influenza, or we shorten it to H flu. That's the one that was the, like when I went to medical school, that was the number one cause of bacterial meningitis in children. But because of the vaccine, it has greatly reduced and is now the number four cause.
mm.
There is a fourth type that I'll highlight called Listeria monocytogenes or Listeria. And this is a food-borne bacteria, and
Foodborne.
it foodborne. Yes,
Okay.
foodborne. It typically travels in our food, and this is the one that attacks people that are immunocompromised. We talked about it. People that have a poor immune system. So that includes people with cancer, on chemo, diabetes, even pregnant women, and those above the age of 50 will get this type of vaccine. There are a few other bacteria that cause bacterial meningitis, but I don't want this to become a lecture. Is supposed to be a conversation. So we have the children and newborns. We have adolescents up to the age of 12 and a booster at 16. Children, and then those above the age of 50 and or immunocompromised all deserve the vaccine.
Mm. All right. Thank you very much for your thoughts on that one, Dr. Abiola. Now, how is meningitis transmitted from one person to the other? What is it? Is it something that can be transferred or transmitted via blood, saliva, bodily fluid, and all of that? How exactly is meningitis transmitted from one person to another person?
Very good question. Besides the one we just mentioned, listeria that can travel in food, it's mainly transmitted through the air.
Wow.
So, which is a bit scary. And when you talked about your trip to the north, I think you said to Sokoto,
Yes,
and they
Sokoto.
advised you to do the vaccine and everything.
Mm.
There's a reason behind that. Most of the cases in Nigeria are from the north,
Mm.
and because in the north, some of the things that um, make the bacteria travel through the air better is that when it's dry, which is in the north, right? When the temperature is higher, which makes this an important disease that's discussed during Hamatan, or is that how I say it, Hamatan region? During this Hamatan time, it's more windy, the temperature is higher, and it's drier. All three of those make it easier for the bacteria to float through the air. And the Hamatan is a wind system, so that wind comes from the north of Nigeria and now blows through the south.
Mm.
So if we look at the top 25 states that have it, they're mainly in the north. The top 10, which are the most severe, are also in the north. And we'll talk about some of those states
Mm,
later on.
mm, mm. Okay, so I was going to ask you about this region because I know that in recent time there have been reports and cases of the meningitis outbreak in Nigeria and all of that. And I think you just answered it a bit because I was going to ask you if there are regions or countries which are more prone to this outbreak of meningitis and why.
Let's talk about a few of those. Um, for almost a 1 year period from October to April 2022 to 2023, in Nigeria, we had about 1,700 or 1,700
Wow.
cases of meningitis, and 500 of those were confirmed, and 120 of those people died, meaning 7% of those that were suspected died. And they took tests from 81 local government areas and 22 states. Out of all those 22 states, there was one state that accounted for 74% of all the cases, and that was Jigawa State.
Wow.
And why is because it borders. There's an area in Niger called the Zinder region, and the Zinder region in Niger has had a meningitis outbreak for about 2 years now. And because it shares a border with Jigawa, that's how said this disease is sent through the air. So that's how that state accounts for 74% of all the cases in Nigeria. The other ones that are higher up on the list are Zamfara State, Yobe State, Benue, Gombe State, and Katsina, Oyo State, and your favorite state,
Hmm.
Sokoto. So those are the top ones. They're in the north. They share the same wind. They share borders, and the outbreak in Niger doesn't help things. So, and then you also know in Nigeria, the NCDC has done a pretty good job of categorizing meningitis, but a lot of cases go unreported.
Unreported.
So any number I see, I always know that it's going to be significantly higher in
Hmm.
this country.
Hmm. All right, thank you very much for your thoughts on that one. 26 minutes past 10 from Women Radio 91.7, Nigeria's first and only radio station for women and their families. Glad to know that you're still there, tuned in today's dial. If you're just joining us, you're listening to Radio Doctor. Radio Doctor is a free health consultation program where medical doctors advise for free and consult on Women Radio, WFM 91.7. It is broadcast Mondays through to Fridays, 10 to 11 a.m. And yes, my name is Blessing Agweta. Our radio doctor for today is Dr. Abiola Ajayi, the MD CEO of RA Specialist Hospital, and he is consulting and advising us on meningitis. You can call us on 07000 917 917. Send us a text and a WhatsApp message on 0703 Log into our website www.wfm917.com. Download the mobile app WFM 917. Send in your thoughts to our social media platforms WFM 917. That is how you can be a part of the conversation for today. Okay, so Dr. Abiola, let's talk about this one. Talking about meningitis, how can we diagnose the infection and what the diagnostic tests are commonly used?
It's a good question. This meningitis or cerebrospinal meningitis, as we've been talking about, is not diagnosed like other diseases where you take a blood sample and do that. We have to do something called a lumbar puncture. So, we described the brain and spinal cord are covered by some meninges, some coverings, and there's fluid in between the covering and the spinal cord and the brain. So a lumbar puncture is actually where you take a needle and you put it towards the lower in the lower back, almost close to your buttocks, in between your vertebra, and you puncture that covering, that meninges, and you now try and bring out some of that fluid that's
Oh,
covering. Yeah, it's not it's not the easiest procedure. It can be a little bit nerve wracking. I've done it many times, but I don't like to do it if I don't have to because of the risk. Right? You
okay.
can when you do the lumbar puncture, if the person has a severe swelling in the brain, sometimes you can cause the brain to shift, and that
Wow.
doesn't sound good.
Wait, Dr.
If
Villa,
you
wait, just hold on for a moment. You can cause the brain to shift by puncturing the lower part of the back.
Yeah, if there's too much swelling or what we call cerebral edema, you will have something called uncal herniation. So the brain will try and squeeze itself through the tiny hole in the base of the skull, and you cannot, it cannot fit, and so you can now get brain damage doing that. It's
Wow.
very rare, but it's always in the back of
Wow.
my mind that
This can
so that
happen.
that that procedure should be done by somebody that has experience.
Mm-hmm.
And what we do in the U.S. is we do a CT scan
Mm,
before we do the lumbar puncture just to try and make sure that that doesn't happen. If we see swelling, we'll now give steroids and
mm,
other
mm.
things. So when you do the
Okay,
lumbar
so
puncture, you get
so
some of that.
Dr. Abiola, just before you move on, I need to say this. Don't go and try this on your own. No. Hmm.
Oh
Wait.
no!
Don't say, oh,
You
I
can
know
paralyze.
Dr. Abiola has
You can
already
paralyze the
dissected
person.
the lower part of the back just before you get to the don't try it oh. Don't do it on your own. Okay. So Dr. Abiola, you can move on now.
Yes. So the once you get some of the fluid, we now want to culture it. That's like to see what bacteria will grow out of it, and you want to do something called a gram stain, which is just prepare it and to look under the microscope. But the important thing is, I won't get into the treatment, but the important thing is once you've collected your sample and you have an eye, you just guess, like a clinical educated guess, you start treatment. You don't wait for the lab to give you results. You don't wait for the culture the results to come out. You need to start treatment immediately
Hmm.
because, as we've mentioned before, person can be dead within 24 to 48 hours.
Wow.
So you can't be waiting on the lab before you start treatment.
Hmm.
It's rare to see somebody, especially a young person, battle with meningitis for 4 days without treatment. They'll be dead. They'll be dead
Wow.
without treatment.
So meningitis can be
So
fatal.
it's it's fatal. It's fatal in a lot of cases. There are a minority of cases that the person will get better on their own, but that is not the rule, and that is not the most common. So we try and treat these as aggressively and as soon as possible.
Mm. All right. Thank
So
you.
that's the main thing. That lumbar puncture is of the CSF is the main way to diagnose it.
Okay. Thank you very much, Dr. Abiola, for your thoughts on that one. Now, you talked about um, taking the fluid from the lumbar puncture, using that procedure and all of that. So, the fluid has been taken. What is the role of analyzing that fluid in confirming a meningitis diagnosis?
Yeah. So cerebrospinal fluid, which is in case people are just joining us, is the fluid that bathes the brain and the spinal cord and is sterile, meaning there should not be any bacteria, viruses, or fungus inside, and it should be transparent. It looks like water, really. It really
Okay.
does looks like water. So when you do your lumbar puncture and you're getting out yellowish fluid, that should ring an alarm in your head. If sometimes the fluid can even look like pus, that should ring 10 alarms in your head. And then when you analyze the fluid under the microscope, if you see a lot of white blood cells, you know you've got an issue, and more than likely it's bacterial. Typically in cerebrospinal fluid, if you have any scientists, you should only see about 0 to 5 white blood cells. When you see over that, and sometimes with meningitis, you see 50 to 100. I'm talking about per field. It should alarm you. If those white blood cells are primarily the neutrophil type, they should also worry you. And then we can analyze the fluid for glucose, protein, and something called lactose. And the ratio of those can also give you an idea. So the analysis of the fluid is extremely important because you want to be sure that it's bacterial, because there are other types of meningitis. Fungus can cause meningitis. Virus
Wow.
can cause meningitis, and you won't see them like you see bacteria. So the reason why we're focusing on bacteria is because that's the most deadly of them, right? So that's the role of the fluid analysis.
Hmm. All right. Thank you very much for your thoughts on that one. So, Dr. Abila, you just mentioned that bacteria can cause meningitis, fungi can cause meningitis, and I also know that it can be transmitted. What are other things that can actually cause meningitis?
Yeah, you can have um, non microbial or non organisms, meaning chemicals that enter chemicals or irritants that enter that cerebral spinal fluid can cause meningitis, because as we said before, meningitis is a swelling or inflammation of those structures that cover the brain. So anything that gets in that cerebral spinal fluid can cause meningitis. If you don't do your lumbar puncture well and that person didn't have meningitis, you could give it to them. If
Wow.
you take bacteria from the skin and push it, yeah, the lumbar puncture is a sterile procedure. If anything else follows that needle into that space, it could end up causing meningitis or other symptoms. So that's the main
Cause.
thing.
Mm.
Did I miss something?
Okay,
Yeah.
no,
Did
you've
I, did
answered
I
my
answer your
question.
question?
Yes, you did. You did. All right, this is 26 minutes right before 11 from Women Radio 91.7, Nigeria's first and only radio station for women and their families. Glad to know that you're still there tuned into this now. If you're just joining us, you're listening to Radio Doctor. Radio Doctor is a free house consultation program where medical doctors advise and consult for free. Radio Doctor is broadcast on Women Radio Mondays through to Fridays by 10 a.m. And yesterday on the show, we're talking about meningitis. The radio doctor for today is Dr. Abiola Ajayi, the MDC of our specialist hospital. My name is Blessing Agbait, and you can call us on 07000 917 917 or 7000 917 917. Send us a text and WhatsApp message on 0703 175 6537. Log into our website www.wfm917.com. Download the mobile app WFM 917. Send in your thoughts to our social media platforms WFM 917. That is how you can be a part of the conversation. And yes, we're talking about meningitis. Dr. Abiola has taken out time to tell us what it means when you hear the word meningitis. He has been able to establish the causes of meningitis. He has been able to tell us about, the types as well. He has been able to advise us on all of the things that we need to know. Talked about the age groups, where it is more prominent, and all of that. So, Dr. Abiola, let's talk about some of the complications. I know you said it can be fatal, that is, the person can die, it can be life threatening, and all of that. So, what are the complications and long term effects of meningitis if you refuse to treat yourself as a person? What is going to happen?
Yeah, so let's start with the statistics. Most people make a full recovery, okay, but at times you can have long-term problems and even permanent problems. And the estimate that 1 in 3, or in some cases 1 in 2, people that, which is 33 to 50% that survive meningitis is left with at least one permanent problem. So and the bacterial is more common to have these permanent problems. An example is hearing loss, which a lot of people don't recognize. Hearing loss, and it could be total deafness or partial, is quite common. We talked about convulsions or seizures. Person could be left with a seizure disorder like epilepsy.
Mm. Wow.
Um, I said that it can, just imagine if you have a lot of swelling and it's compressing your brain between the skull, it'd be very hard for your brain to work properly. And so the person will have decreased cognition or decreased cognitive ability, meaning they won't be able to add, subtract, talk, or function the way they were functioning before.
Mm.
And in children and in adults too, it can even decrease intelligence over time. So what happens in a child, they end up with a long-term complication and they survive. That child may not learn at the same rate that they were meant to, or like their peers. So that's quite demoralizing. You can even have vision loss. One of the ones that surprised me, I've not seen it in clinical practice, but I've obviously read about it, is you can end up with the loss of your limb when if the infection spreads throughout the body. You may have to remove limbs, like cut off your
Wow.
arm, cut off your leg, wherever that
Wow.
infection
Wow.
is.
I mean, on this
So
meningitis still.
this is on the bacterial meningitis. Yes.
Wow.
So I talked about the fatal rate. The calculated fatal rate in Nigeria was about 7%.
Mm.
Worldwide is about 10%
Mm.
of people that get bacterial meningitis will die. Out of the 90% that survive, 33 to 50% of them will end up with one of these long-term complications, and that's usually because of treatment delay. So the sooner you start treatment, the less you will see of these long-term complications.
Mm. Mm. All right. Thank you very much for your thoughts on that one, Dr. Abiola. I really do appreciate it. I mean, that was mind blowing. Should I just say mind blowing or shocking as well?
Mhm.
Thank you for taking our time to explain all of these things to us on the show. Now, let's talk about the age groups. What age groups are more susceptible to meningitis and why?
Well, some of the, and we touched on it when we were talking about the different bacteria that cause it. So we separated into children. We call children, 0 to 5, um, and neonates are newborns. So these are in the first year of life. They are susceptible to this. Well, one of the reasons is because we have two types of immune systems. So we have
Okay.
something called acquired immunity, and we have something called innate or inborn immunity. So
Okay.
you can imagine a newborn is born with innate or genetic immunity, what they got from the mom and dad. He or she has not lived long enough to acquire immunity like you and I have, right? So, and you acquire immunity from getting exposed to different things in the environment and surviving. So, children and newborns are susceptible, um, quite susceptible to meningitis. Children, and when we now talk about teenagers, remember there was one called
Mm-hmm.
meningococcal meningitis, and that affects teenagers all the way up to the age of 18. Then you have a period or a group of people that have very or a lot lower risk. Those are those between 18 and 50. And then again, the risk starts increasing again above the age of 50. And I would have to say that, well, those are the age groups, right? And then we have to include anybody that is immunocompromised, regardless of the age. Anybody that has an issue with their immune system, regardless of the age, is also highly susceptible.
All right. Thank you very much, Dr.
Oh, and then you
Abiola.
asked me why.
Why?
You asked me why. I
Yes, I did.
mentioned why for most of them, the immunity has not developed, or the person is immune compromised. Then for the adolescents, the teenagers and such, it's been hypothesized that, especially in Nigeria, we have about 60% of the cases are males and 40% are women. And it's hypothesized that the men engage in activities that reduce their immune response. For example, smoking, alcohol, working long hours, and stress. It's suspected that may be the reason why it's a little bit higher in men than in women, and but the rest centers around your immune system.
Mm. All right. Thank you very much, Dr. Bila, for that one. Now, this meningitis that you're talking about, if we look at it very well, there are some information that are a bit scary. The fact that it's even fatal is something to be worried about. It's something to be concerned about. Now, once you have, when an individual has meningitis or has been confirmed to be battling with meningitis, what is the treatment option, or what are the treatment options and medications that can be used to cure it at that point in time? And I'm also going to ask, if you have meningitis, does that mean you always have meningitis, or once it is treated, you are free?
Okay, I'll take the question in reverse order. So, if you get meningitis, you can actually treat it and cure it, especially bacterial meningitis. That's what's encouraging. If there's anything encouraging about this lecture today, is that if you get on the treatment early and get on the right treatment, there's a very good chance that you'll make a full recovery. And we mentioned those people recover fully in about 90% rate.
Okay.
The the other first part of your question was
How is
about
it being
treatment.
treated? Yes.
Yeah. So one of the signs. I'll just take this opportunity to discuss fever.
Okay.
Something even I learned through because I treated so many patients for COVID. Not all fevers are bad. Meaning, when your body is raising the temperature, you're meant to treat it like an indicator. Just like if you were walking and you stepped on a nail, you'd feel some pain, right?
Yes.
And that pain lets you know that you have an injury and tells you that you should probably go and get that injury taken care of. That's how we should treat a fever. When you have a fever, especially a high fever, it should tell you that, hey, I've got something going on severe, and let me go to a doctor and get treated. But what we like to do, and this is human nature, we like to self-medicate.
Mm-hmm.
So
A
people
lot.
get a fever. Yeah, get a fever. You run to the chemist. Oh, I have a fever. Give me something to. Yeah, and it may reduce it temporarily, but guess what's happening to the bacteria in the cerebral spinal fluid? They're still growing, and you know that we're on a clock. You have to you have to get treatment within a couple of days, or this person, or you may not survive. So fever, pain, headache, you want to treat them as indicators that tell you to go and seek professional help. And so the first part of treatment is going to the hospital, right? Going to the hospital, being very free with your history, and telling your doctor everything
It needs to
that's
know.
affecting you. Exactly.
Mm.
Then once you're in the hospital, you're going to do the lumbar puncture, like we said, gather CSF, and then it's antibiotics. So when we look at the different, that's why it's important that you ask those questions. Which groups of people get it? What are the signs and symptoms? Because really, that's what you're going to be using to determine your that you're going to go ahead and treat. So if I see somebody with a fever, a headache, a stiff neck, and they're in those age groups, or they have some immunocompromised, I have to put that on my list, high on my list of meningitis. And then we use antibiotics
Mm.
for bacterial meningitis. I won't mention the names of the drugs, but there's a class of drugs called cephalosporins that work very well, and third generation cephalosporins work the best. So we use those, and it may be treatment for anywhere up to 2 weeks, depending on how the person responds. But I've never heard of somebody going treatment for less than 10 days. 7 to 10 days is a minimum. Up to 2 weeks or beyond is ideal. You also treat the symptoms. At times the person may have trouble breathing, so you give them oxygen. At other times, if you're now in the hospital and the antibiotics have been treated, of course we're going to treat the headache, we're going to treat the pain, and we'll treat swelling. And one of the ways we treat swelling is with steroids. This is an important thing to mention, that we talk about brain swelling. So the research shows that adults that get steroids on time reduce the chance of them having that severe brain swelling and the long-term effects, some of those long-term side effects that we mentioned earlier. So that should be part of the treatment regimen.
Mm. All right.
So that's how you treat it in the hospital. That's the
Mm.
main way you treat it in the hospital.
Mm.
Then
So
antibiotics, treat fevers, painkillers. If they're vomiting, treat vomiting. that kind of thing. But the most important thing is to take your sample properly and start the antibiotics on time.
Okay, thank you very much for that one. I mean, this is more like the pharmaceutical way you can treat yourself. Let's talk about ways we can prevent meningitis. If there is a cause and there is a solution and there is a treatment, I think there should be ways by which we can prevent, coming down with meningitis. I would like you to take us through that.
Yeah, there are a lot of things to do that we can do at home or do in our lives to prevent. For example, nutritional support. You know,
Okay.
we've talked about nutrition this whole year, and the importance of having a balanced diet and getting all your vitamins and minerals. But you would want somebody to have a balanced, full diet. It's not the kind of person that you'd want to be eating pap every
Mm,
single day, right? So
mm,
the best, because you need variety, you need different what we call phytonutrients and different vitamins and minerals to help support your immune system, and that's really what you want to do. So another thing that helps support it: sleeping well,
mm.
sleeping enough, and also sleeping in a well aerated area, meaning breezy, right? You
Okay.
you want you want the place to be free. You want to avoid sharing airspace with others or
Oh,
avoid overcrowding.
okay.
So,
Overcrowding.
if you're in a room, if you can help it, you don't want more than two or three people in there because you're all sharing that air. And if one
Mm,
of you gets it, so let me talk about incubation period. So imagine if I'm sitting in a room, the person across from me has the bacteria and they're breathing it into the air. If I breathe it in, it may take anywhere, the average time it takes about 4 days for the infection to show.
wow.
And after those so during that 4 days, I may be infecting other people.
Without
So
knowing.
it takes without knowing exactly. It now takes average of 4 days, but it can take up to 10 days, anywhere from 2 to 10 days to show up, and then those symptoms will show, headache, fever, and all of that. So avoiding overcrowding is a big one. If you have a cough during that period, you want to cough into your elbow. That's the new way. We learned that during COVID,
Yes,
right? To cough into our
absolutely.
elbow, not to just cough into the environment, and not to cough into your hands
Mm,
because your hands touch everything. And that leads us into washing of hands, just like we did. And we keep mentioning COVID. The reason why I keep mentioning COVID with bacterial meningitis is because both of them are transmitted through the air. They're
okay.
both transmitted by respiratory. They call them respiratory droplets. So as we're talking, if anybody has glasses or is close to a window, if you just exhale or breathe out onto the window, you'll see that it will mist up. That's because your air that you're breathing in and out, or your breath, has moisture inside. We can't see it as we're talking, but you can see it when you hold a mirror up to yourself or a piece of glass. So that is where the bacteria will live, in that moisture in your breath, and it can float to the air, and it can live outside the body for days before infecting someone.
Mm,
So, in the same vein, you want to avoid crowds, avoid overcrowding, and all of that. One of the things that we did during COVID is, if we were worried about a respiratory virus or respiratory bacteria, we would use steam inhalation to try and disinfect the nasal passages and the nasal oral passages. So that may be also useful.
mm,
So those are some of the main preventions. The people that are at risk, when we talk about that prevention, those that live in an overcrowded house, those
mm.
that live on campus, like college students
Oh,
or university students,
I have five,
because
six
they're
in the room.
a lot of them in a closed space. You're all in the lecture hall together, or you're all in the dorm room together. Those are um, some of the high risk people, and of course, spouse, husband, wife, those that live in very, very close proximity can be
Mm,
at risk as well.
mm. Okay, thank you very, very much for your thoughts on the show this morning, Dr. Biola. We have been able to learn so much, so much on the subject matter for today. So thank you for creating our time to enlighten us on radio. We do appreciate you. As we wrap up on the show today, I would like to ask, for individuals who may probably suspect that they or someone around them may have contracted meningitis, what should they do?
Number one thing is take that person straight to the, straight to the health center, to the doctor that you trust, to the hospital in your area. The time is of the essence, right?
Time.
And separating that person, time is of the essence. The sooner, when in the states, we once we hear meningitis, I'm working in the hospital in the U.S. Once we hear meningitis case, everybody gets nervous. Everybody gets sensitive. We have a
Wow.
heightened sense of awareness. You
Wow.
start gloving up, you mask up, you want to quarantine that patient. We go into a special protocol. We take it extremely seriously
Wow.
because it can be transmitted to others, and you don't have time. So we
Mm.
start the clock. Once you have a person suspected, we start the clock. Every hour makes a difference. So
Mm.
that's why you don't wait for this result, don't wait for that result. Quickly set your line and start your antibiotics and be checking. So the
Mm.
main thing is get that person in front of. The best thing you can do is don't delay. Get them in front. This is not something you want to run and go get Panadol or sorry one of these headache medications and just watch the person. That's not what you want to do. You want to get them in front of an experienced clinician, experienced doctor, and be free with the information.
Mm. All right. Thank you very, very much, Dr. Biola Jai, MDC of our Specialist Hospital, for today's free consultation and advice on meningitis. Do well to enjoy the rest of your day.
I will. I will. Thank you so much. Have a
All
good
right,
weekend.
thank you. Well, there you have it from Dr. Biola Ajayi, the MD CEO of our A Specialist Hospital. Honestly, he has taken our time to enlighten us on so many things. Remember, when it comes to meningitis, time is of essence. So if you, by any chance, realize that you're probably going through or you're suffering from meningitis, the first thing is for you to head to the hospital for prompt and immediate treatment. Remember, every time counts. This is why it is very important for you to take immediate steps to take care of yourself. Dr. Abiola is the MDC of our specialist hospital. So, yes, for consultation, just, reach out to this number 0900913 579 5108. So if you want to reach out to Dr. Abiola, you want to have conversations with him, you can call him on 0913 579 5108 0913 579 5108. You can also call 0816 601 5901 0816 601 4901. That is how you can reach out to Dr. Abiola. And of course, you can reach out to him across the social media platforms, ROA Specialist Hospital, Facebook, Instagram, YouTube, Twitter, ROA Hospital, or visit their website, www.theroahospital.com. Thank you very much for being a part of the conversation. I really do appreciate you. Radio Doctor on Women Radio, WFM 91.7 is Nigeria's first specialized radio health program. Broadcast Mondays through to Fridays on Women Radio, WFM 91.7 from 10 a.m. Join us again on Monday for another exciting and enlightening moment on radio. Many thanks to the producer, Aisha Sani, and the executive producer, Tung Okewale Shulaya. My name is Blessing Agbeito. Have a healthy day.
To sponsor this program, call the number 0816 480 7613.
Mama pikin, you don born now o. No forget say e dey important say make you dey chop healthy food plus fruits and vegetables wey be say go do your body better so that you and your baby go dey well and fresh.
Thank you, Auntie. I dey chop now.
See, make I remind you say to stop to dey breastfeed your pikin only dey alright after 6 months and you no need add water join am.
Mommy, yo, so that Junior go sharp pass us.
So you know sharp, abi?
You wait for don turn professor since.
Mama pikin, also make sure say you collect all the immunization wey pikin suppose collect and make you collect am early o.
I no fit forget.
My fellow women, remember say after you don born, you still fit go any primary health care center to complain about anything wey dey do you or your pikin. Your ogbonge health people dey